Thank you for joining us today, and we'll just get started in just a moment. All right, so we'll go ahead and get started here. And good afternoon, and thank you for listening in today for our weekly update. This is Jessica Counts, Sales and Events Manager for the California Hotel and Lodging Association. First, I'd like to say if there is a media or any reporters on this call, to please exit now. This information is not authorized for media usage. Thank you. And please continue to use CHLA as a resource. We're here to support you and provide reliable information on how to help you manage your business safely. And after this week's call, we will be going to bi-weekly webinars every other Thursday to provide you with a timely state update. So our next state update will be on Thursday, April 30th at 2 p.m. as well. And today's presentation will be recorded and posted on our website at calodging.com. You'll be able to view the presentation in the coronavirus updates and resources section, along with our business and employee programs, safety guidelines, and some other information that's available for you, along with our archived webinars related to COVID-19 are also listed here as well. And any questions during today's presentation, please go ahead and submit them through the toolbar at any time during the hour. Your questions are important to us and will help us establish how else we can service you during the pandemic. So we do appreciate that. And again, if there is media or any reporters on this call, please exit now. This information is not authorized for media usage. Thank you. And our president, Lynn Mohrfeld of CHLA, will cover some of the latest state updates to keep you informed, and he'll go ahead and get us started here.
Great, thank you, Jessica. And thank you for setting up the webinar and making everything go smoothly, at least up to this point. Very much appreciated, so thank you. Well, it's Thursday afternoon, so we must be talking about COVID-19 and the effects on the hotel industry. Today, in addition to my update, we'll hear from Carl Winston, director of this is a mouthful, the L. Robert Payne School of Hospitality and Tourism Management at San Diego State University. Happens to be my alma mater, go Aztecs. Carl will be providing us an overview of the future of meetings, which, like everything else, will be changing. So, hold on, I'm trying to change my slide. There we go. So just like I said last week, our website's an excellent resource. Jessica went over this as well. Please email us if you have questions. We have everything on there in chronological order, how we developed the website over the week. And then this week we added a legal section on the website. So we've kind of curated all the legal information out there and divided it up by topic and a few others. So please do check out that accordion fold on the website as well. Today I want to mix it up a little bit and talk about our advocacy and the mechanics of decision making at the state level, and then I'll talk about the governor's plan for a return to the new normal. Informally, I've heard it being referred to as our re-entry plan. And I know that President Trump is also dealing with this as well. And then finally, before we'll hear from Carl, I'll provide an update on the ever-changing hotel volunteer opportunities. Just can't believe those. There's always something new with those. So first of all, the governor's been having 30-minute press conferences daily at noon. And so who knew? I'd be eating lunch with the governor every day. Business community leadership, we usually get a text about a few minutes before, a half an hour before these pressers, as we call them, regarding the topic for the day, which has been helpful, helps us prepare any kind of responses, etc. So it's nice to get a little heads up, and the business community has been very involved in these processes. So these pressers are usually driven by priority issues, hospitals, mass, regional coordination, whatever the most urgent task and priority is for the day. And I think that Governor Newsom has generally been getting high marks for these. So if you watch these, one thing that I watch for, and if I don't get a chance to watch them, I go back and look at the end. I watch for the media questions at the end to look for the strengths and the weaknesses of the state approach, and also the tone of the questions and whether they're critical or complimentary. These are usually pretty telling and kind of interest in terms of where the media is going and where the priorities are going. So just kind of a little tip in terms of doing that rather than watching the whole half an hour, you can fast forward to the media tips. And just like clockwork, if the media asks about hotels, I can usually expect to field 3 to 5 calls before the day is out. Today, the governor said that he was going to talk about the Project Room Key, which I'm going to talk about later, and the hotels on Saturday. So sure enough, I've got a couple of emails in my inbox about this already. So let's talk about the decision-making process. Privately, it seems to be made what we call the horseshoe, and that is the governor's appointees that kind of act like a cabinet on a federal level. This is really a tight group, and this allows for speed, but it sometimes lacks the efficiency due to the business perspective. So you'll see it from our industry when they have these ever-changing volunteer hotel programs, which I just mentioned. They get introduced, and then all of a sudden they need clarification with contracting processes, operational considerations. That's usually because our members are calling me, and I'm calling the governor's office, social services, Go Biz, whoever we're dealing with at the moment, and talk to them about this and say, what about this? What about that? And so they're adjusting afterwards. Probably the first example we saw of this, which still we don't have clarification, is whether hotels are essential businesses. Government is just moving really, really fast right now, so you have to take that into consideration. So the business community leadership, we've banded together. We're in the process of asking for formal involvement, and as these type of issues and crises evolve, usually that's exactly how they go. Government's pretty insulated in the beginning, and then they bring in businesses, and then we get more of a holistic approach on it, and that's exactly what's happening. So for the last, I'm going to say 5 weeks now, I'm kind of losing track of time. We've been having weekly coalition calls with all the travel industry association executives. We've made specific economic relief requests twice now. And then these weekly calls are with GoBiz, State's Economic Development Agency. The governor's office usually jumps on for a little while and gives us an update on these, and then Visit California is on them as well. So it's great to hear kind of what everyone else is going through in retail, attractions, restaurants, etc. So those are very helpful for us. So right now we're getting down to what we're looking at is stabilizing the public health issue, and now the government kind of shifts into developing indemnification language and what the recovery process is. And so, you know, our next asks are, how do we not avoid, or how do we avoid a huge litigation issue on the backside of this? We know the trial attorneys are going to come out of the woodwork after this, and so we're asking for some type of indemnification. We're a little bit different animal than other businesses in that we're hosting first responders, healthcare workers, and we've got these Project Room Key, and so indemnification is pretty key for us. And then the other one that seems to have been omitted lately is the commercial mortgage-backed securities, CMBS loans, and so we're going to try and ask for some guidance on those as well. And then finally, on the advocacy front, legislature closed. Okay, so both houses have now said, the Assembly and the Senate, so they'll only be focusing on COVID-19 related issues. Okay, that said, I can tell you that in the background, they haven't stopped working on other stuff. So there's a big bill out there, which is a fix for AB 5, which was the independent contractor legislation aimed at the Ubers and the Lyfts of the world. That's still a lot of activity going on there. And unfortunately, the resort bill is still going through the processes as well. So we're working on language in those. This is the only thing we're working on. Next up is the state's plan. It's included in your handouts. on the side panel there. I won't spend a lot of time on this. It's on our website as well. Governor announced a path to getting back to normal, and you can review the 6 steps, and the guidance is coming out federally as well. President Trump is got a little bit different process in terms of how he wants to do this, and so I think there's going to be some back and forth on this before we're done. However, all this said, I think that our guests and ourselves, we're going to be the ones to decide when we go back to work and when we go back to living whatever our new normal looks like. So I'm less worried about what the government says at this point for how we're going to get back to a normal life. Rather, I'm interested in what our guests say and when we can go out and travel, when people feel comfortable doing things. So onward, hotel volunteer opportunities. In the handouts, I think we've got Project Room Key overview in there as one of the items. And then the Department of General Services is also reaching out for rate codes as well for first responders and healthcare workers. So before I get to a couple issues on Project Room Key, on the rate codes, this is a short-term process. The program is expiring at the end of this month, and it's going to be replaced with a similar program. We don't exactly know what that looks like, but it seems like it's going to be a combination of rate codes within your reservation system and accepting / executing an agreement. And the occupancy agreement, I put that in the handouts as well. I've included that as a Word document so that you can make notes on that, etc. This is not a final. There will be tweaks to this. I understand the tweaks are going to be more in terms of guest and employee interaction, but this should be the core of what the agreement is going to be. So on Project Room Key, you got to be aware of some challenges. So we're getting some NIMBYism. Not in my backyard attitude from the cities. So yesterday there was a hotel that was sued in Laguna Hills for participating in Orange County's efforts. The hotel negotiated a program with the hotel. Everything was good. County didn't clue in the city. City is now litigating this. So it's in the media as well. Check with your city on this. This is something that we didn't think of, the county didn't think of, the state didn't think of. I can tell you right now that I've personally made them aware of this issue, and this is definitely a huge issue. We don't want to do the right thing and then be punished for it. So definitely, if you're looking at these opportunities and you're going to lease out your entire property, check with your city, please. And then yesterday, it was kind of focused down in LA, but it's statewide. The hashtag #NoVacancyCA was trending on Twitter, kind of a little scary, and then they've got a website up there, largely focused on the homeless side. But however, it definitely has some issues in there with the hotels, and we're just by just being associated with this and offering our help, we're being associated with the slow process that's going through the government process, and housing the homeless is a little bit difficult. Let me go back to that one. In terms of the homeless, there's some hiccups in this. In all likelihood, you're going to have wraparound services that are in the process with this, and we're not healthcare facilities and we're not long-term care. So you have to start thinking about these things when you take in these populations, and I've mentioned this previously as well. You're not going to know who is COVID-19 exposed or positive, but you're going to need to do your best for both your guests and your employees on this. So I encourage everyone to use common sense, try and do the right thing. Again, on the right-hand side, I think there's it's on my right-hand side anyway, in your chat box, there is a resource for safety protocols for your employees and for your guests. Please review that. Make sure there is social distancing, follow the cleaning suggestions, make sure your employees are safe, but just try and do the right thing on this. It's really confusing out there. And speaking of confusing, I'm going to kind of leave you guys hanging with a final note here. San Francisco, they issued an emergency order earlier this week saying hotels can't remove a COVID positive guest but you can refuse to allow one to check in. Apparently, there was a first responder that was already in a hotel. They said they were COVID positive. The hotel asked them to leave. This has obviously created an issue. It's only in San Francisco right now, but it could spread to other areas. But all I can say in this entire instance is just please use common sense on this. Again, we're not medical facilities, and we've got conflicting issues here. You've got a duty of care to your employees and your guests. And now you've got an order from, if you're in San Francisco, you've got an order that you have to house COVID positive. So do the right thing. If you don't think that your facility is, or your protocols are up for housing positives, I think that you should consider denying that person. There is no enforcement mechanism in San Francisco. But again, I'm going to say use common sense and try and do whatever you can to make sure this happens. But wish I could provide better guidance here, and I'm hoping to, but right now this is as good as we have for right now. So on that happy note, I'm going to turn it over to Carl, and he's going to tell us all about the future of meetings. Carl?
Thank you, Lynn. Nice presentation. A lot of very interesting news, and I want to figure out how to get back to the. Are you sharing your screen? I'm not seeing it. I'm not seeing it. Technical.
How about I'm on your first slide?
Yes. Okay, I got it. I see it
there
now.
Yeah.
Thank you. All right. So the question is, are face-to-face meetings even going to come back? And I'm here to give an emphatic yes. Some evidence of that, 10, 15 years ago when video conferencing first came out, the pundits all said, oh, it's going to replace live meetings. And what we found out was that social events came back pretty fast because they require face-to-face interactions. You're going to a wedding, you probably want to dance with the bride. And business events will also come back because there are all kinds of data that show that in establishing relationships and making sales-related kinds of transactions, face-to-face meetings are 20 to 30 times more effective than online. So I know it's coming back. I've been through enough of these that health, economic, we always come roaring back. It's just going to take a little time. I think what is different is that we now have this virtual element, and it's going to escalate and as an option because certain populations are going to demand it. So the big question for you is, are you ready? All right, so what does virtually ready mean? First off, meeting design and architecture are going to change. You're going to need more equipment. You're going to need a lot more bandwidth than you have right now. Doesn't that sound cheap? Just think about things like lighting and where would you be placing cameras? Does your audiovisual supplier have enough cameras? Are they of a good enough quality? Do your staff know how to lay out a room that's got both a virtual element and a live element? They probably don't. You're going to need to train them. And yeah, I'm going to give you a couple examples some people may not like, but if you get married in Las Vegas, they do all those weddings virtually. So the kids who go crazy and fall in love with somebody over the weekend can show their friends and family. Funeral homes have been virtual for quite a long time now because not everybody can travel to funerals because they're usually last minute. I'm not recommending you necessarily hire a funeral person, but they would have the expertise and understanding of how to lay out a room, set it up, and do both a live and virtual event. So it is a very changing time. We're in a little bit of uncharted territory, but as you're contemplating those things about what does it mean to be virtually ready, it's pretty basic, but I would challenge your teams, those of you who still have teams on your properties, to get ready. So there's also something else that Lynn asked me to talk about that's both an opportunity and a threat for your future. So the new gold standard for events and venues like hotels, in our collective opinion, and we've been talking about this for weeks now, is safety, sanitation, and health. And that those words have always meant something, but I think the ante just got upped quite a bit. I've spoken with several planners at Fortune 50 and Fortune 500 companies, and they're saying that their whole way they're going to source future meetings is going to mandate that the venue's entire supply chain is safe. So what do I mean by supply chain? Supply chain is everything from your food vendors to your audiovisual. I mean, when's the last time anybody said, hey, Lynn Mohrfeld, we've sanitized your lavalier mic for your live presentation? That's not a procedure today. It is actually going to be a procedure tomorrow. How do we ensure that your driver of the hotel van is healthy? How often are you going to check that driver? You're going to have to. So let's go on to the next slide, and I'll talk a little bit about some inspiration that people on this webinar might want to listen to. And I went and looked at what other parts of the world are doing in COVID response and in disease response. And the things you see on the screen in front of you are inspired from Singapore. And certainly the US is not Singapore, but this might give you some insight and things to think about in talking to your teams back at your property about meetings of the future and what some of the planners are going to be expecting. So a key recommendation is having somebody in charge of safety, sanitation, and health. You know, it could be HR, but it doesn't necessarily have to be that person. But this is really a very, very, very different bar. Having visible procedures, you know, having that hand sanitizer in lots of places, disinfecting way more often and way more publicly. People are going to be scared to be in your hotels. Some guests are going to be scared to be in your hotels. You know, monitoring employee and vendor delivery health is something that we've just scratched the surface on, but I'm not sure we've gone all the way. And it would really urge the people on this call to think about ways to do that. When do you send somebody home if they have a temperature? Are you going to be getting temperature guns? I think you are, by the way. And being hyper vigilant. So that's a whole new way of thinking. And since most of you, or at least half of you, are dark in your hotel right now, this is a heck of a good time to get on this. Another thing, as I've mentioned a couple times, is making sure your entire supply chain knows that you need to be proven that if you're going to continue to buy products and services from them, that their people are healthy, that their stuff they're selling you is sanitized, and it's safe. And another thing they're doing in Singapore that I wanted to share was, in Singapore, they are actually mandating hotels to report on guests who have symptoms. They're using temperature guns, and they're saying to their front desk people and to the servers, if you see a guest with sniffles and that sort of thing, you need to report it to a manager, and the manager is going to then decide how to deal with it. That's crazy, and as Lynn said to me when I shared this with him earlier, that Carl, this is the United States. I know it is. I'm just trying to offer some provocative things for you all to think about, because I can see in the future court case. So, Mr. Mohrfeld, you saw a guest with a fever and sniffles and coughing, and now a bunch of your guests have some horrible disease. Why didn't you deal with it? So maybe I'm being a little paranoid, but it's something that you all ought to be thinking about. What does it look like in terms of social distancing? I think social distancing is a thing that is going to evolve. I think there's a revenue management strategy here with social distancing, because I think some guests are going to come in and say, I want the cheapest event possible, you know, give me a 10 top. And you may decide as a business to sell them at 10, you know, tables of 10. But you may want to offer tables of 4 and charge more. Large tables of 4 will cost you a premium. I think there's an opportunity there to revenue manage around social distancing options. I think the same could occur in your food and beverage areas, dining rooms, bars, even the pools, where you get lots of space, you pay a little bit more, but you feel a little bit safer.
Definitely.
Yep.
Thank you, Carl. Really appreciate that. And kind of piggybacking on Carl's comments, CHLA has been trying to source temperature guns, thermometer guns for the hotels right now. Those are all restricted for healthcare and medical use at this point. But if we're hosting COVID-19 patients and positives, it's something that we need to get our hands on. So we're trying to figure out how to do that right now as well. And then I was also having another discussion today about, hey, we may come to the point where our rooms are cleaned and sanitized, and when the housekeeper leaves the room, there's a seal that's put on the room. So whether that's a tape or this room is sanitized or something, and putting that on there, and that's broken by the guest when they check in, when they use their key on the room. So the normal is going to be a new normal for sure. So we'll see what happens. Thank you.
Can we give a shameless plug to our virtual meeting and events series that we're going to be putting on in conjunction with CHLA? There's a handout that outlines those, and we'll be publishing dates as soon as Lynn and I can negotiate that. But we're very excited. Those of you who have venues that hold meetings, we've got programming on how to build virtual components into your venue. So in a lot more detail than we did today.
Excellent. Thank you. Stay tuned for that, and it's in the handouts on the side again. Jennifer, questions?
Yes, we do have a few questions. Thank you. And please, if you have some, type those into your question bar. One question, Lynn, is what is the latest on property tax deferment and penalty waiving? About, people are asking if they should be sending in their property tax checks.
Yeah, that's a tough one. We tried to get this done at a state level. The way that California works is that this is all handled in the individual counties, all 58 of them. So we had previously put out last week, we put out guidance that said, hey, send them a letter and ask for a waiver. There is revenue and taxation code out there that says if there is an event where you've been affected, you can request a waiver. I think that the waivers are going to be given. That said, it's a business decision at this point. So whatever you do, if you pay it, of course, that's fine. If you don't pay it, I would definitely tell them why you aren't paying and see if you can put in as much backup as you can. I think that is in last week's guidance on our website. There is a summary and an overview on that. So please look at that. It's a fluid thing at this point, but the code points to a waiver of penalties. The only issue there is it says, the code says you may request a waiver, not necessarily that you're guaranteed a waiver for it. So there's a certain amount of risk not paying your property taxes. So I'm sorry I can't be more clear on that.
Thank you. Next question is there any update on the details of the state rate code for medical professionals?
There isn't, given the governor's mention today, and I've kind of been chatting with different agencies at the state level. Saturday is when this is most likely to come out, now that he said Saturday is going to talk about this. So I would imagine it's going to come out. There is on caltravelstore.com. There is a email address that you can put your tell them that you're interested there. I don't know how far that's going to get you, so I would wait. If anyone is looking for the specific rate codes and how to set those up for your brands or for your properties, please send me an email at Lynn, Lynn, at calodging.com, and I'll be sure and get those to you, and I can interface with DGS on that. But please know that, as I mentioned, that program is going to be changing a little bit.
Okay, thank you. The next question is in regards to the employees getting the additional $600. Any suggestions on how we can keep employees from electing to get furlough to try to get unemployment?
Boy, this is a tough one. I wanted to say, hey, Carl, can you take this one? No. This is, we've seen this come up before, and it's been an issue mainly with closed hotels, and then all of a sudden they contract to do project room key and then reopen, and they can't get their hotel employees back. So there's several reasons for this. One is they may be caring for someone at home that is COVID exposed, COVID positive. They may be COVID exposed themselves. They may have kids at home. And then finally, as the questioner said, the benefits that they're receiving may be a factor in whether they come back. So right now, it seems like it's a big factor in some markets. Other markets, we haven't seen it be that big of a factor. So definitely something to consider, especially if you're closed and then wanting to reopen. I think it's going to be an issue down the line. So you've got 12 weeks of those benefits that are going to come through.
Great, thank you. One last question. Don't know if you can touch on this. Is there likely a date for partial or full opening of the economy? I know the governor has been speaking in generic terms. Lynn, do you have any feeling or forecast on that?
I don't. It's a moving target, and in the governor's press conference today, you could tell he had a little disappointment that the reported deaths continue to climb in the last 2 days, only incrementally. But any increase in that is unfortunate, and so I think that that's going to temper the ability to reopen the economy. We know that the president on a federal level is definitely more interested in opening this sooner rather than later. But I think that both earlier this week, both the governors on the left coast and the right coast, the west coast and the east coast, have banded together in terms of how they're going to open. So I think it's going to be more of a group effort, especially on the west coast with Oregon and Washington. And Washington's gone through this, and they're pretty good at it. In terms of their response now, and they know what to do. They're a little bit further ahead in terms of the curve. So I think there's going to be a group approach, but in terms of any specific date out there, I just really couldn't even make a guess at that. I don't think Governor Newsom could either.
This is another question, again, that there probably is not an answer out there. I don't know if Carl or Lynn had any thoughts on this. The question is, what group size limitations are being discussed for indoor and outdoor venues? Will there be a one-size-fit-all guidelines, do you think, or will they have lower density locations have different restrictions than higher density locations?
The answer is yes.
Any thoughts?
Yeah, the answer is yes. It's going to tremendous. It really is varying by locality, and there's literally no science behind it. It is governors, mayors, elected, unelected officials making arbitrary decisions. And I don't think there's going to be anything settled in the near future, because there are no data that says that a group of 4 is safer than a group of 10 or a group of 100. It's just literally municipalities making it up as they go. So I think the main thing that I would encourage people on this webinar to do is give people social distancing options, and at least have a policy for your building that gives people the understanding that you're aware of it and that you'll comply with local ordinances, and here's what you can do. Yeah,
and kind of building on that in a previous question, I will say that I envision the recovery and the kind of reentry or reopenings to be very uneven. The health departments in the counties have been driving this, and they've been driving this from a public perspective, public health perspective, not necessarily a business perspective. And I think you're going to see all kinds of different regulations and rules, and some are going to relax it more and some are going to relax it less. And it's going to take a while before it all shakes out and we get common guidelines on this.
Great. Thank you, Lynn, and thank you, Carl. Again, please refer to our website at www.calodging.com, and there on our homepage you'll find our most recent coronavirus updates and resource pages that's updated regularly. This is where we will post today's presentation. Also, please visit our events calendar to register for other upcoming webinars that you may find helpful. Next week we have how to prep your property for the best year yet, and working from home, or office ergonomics, and more. Mm-hmm. Lynn's next date update will be on Thursday, April 30th. Thank you again for listening, and hope you find these presentations helpful.
Thank
you.
Have
a good day and stay safe.